Budding flowers, more relaxed restrictions, and more vaccinations. Find out where we stand with COVID-19 as we talk with DHHS Secretary Dr. Mandy Cohen. Thank you, Secretary Cohen, for visiting with us again at Tuesday's press conference. I saw a smile on your face. Things are certainly, as you say, getting better. The number of new cases is down to around the 1,000 mark per day, which is great news. Hospitalizations down below 1,000. There was lots of good news in releasing the 4 key metrics that you talk about every time you're on in these press conferences. You say we are in a promising place. I'd like to know, first of all, what do you think has gotten us to this place? And is it your expectation it's going to continue?
Well, first, thanks, Tom, again, for the opportunity to talk through where we are. And I would say it's been a lot of hard work has gotten to us where we are right now. I think that this has been a really challenging year with a really contagious and often deadly virus. And we've had to work really hard to contain it. But now we have a really powerful tool, and it's the vaccine that I think is the game changer here. And so while we look at our 4 key metrics to really understand the level of viral spread, what's different now is that we are able to really have a significant amount of vaccine out across North Carolina, with almost a third of adults at this point have had at least one vaccine. That means some protection from this virus, and that is a game changer in my mind. But the other thing that I'm looking at on the other side in terms of concern is that we know this virus is changing. It's what viruses do. It's what the flu does every year, which is why we have to get a new flu shot each and every year. This virus is changing, and we are monitoring how it is changing and what that would mean for us. Right now, we see those changes still be the vaccine be very effective, even though the virus is changing. But that's why I think the more we can vaccinate, the faster everyone can get their vaccine, I think the better, and we'll continue with those trends.
We're seeing a lot of news stories, television, national TV, national papers, and so forth, comparing states and where they rank insofar as relaxations and restrictions versus numbers of cases and deaths and hospitalizations. Where does North Carolina rank vis-a-vis other states?
Yeah, this is where I'm incredibly proud of North Carolina. I think we have struck that balance between slowing the spread of the virus and making sure we know that there is economic impact of everything that's been going on with the pandemic. And so what we're seeing in our numbers is that we've had lower cases, lower hospitalizations, lower deaths than our surrounding partners here in the Southeast, or surrounding states here in the Southeast. And I think that's been because we've tried to strike this balance and follow the science and the data. You know, these have been really hard decisions from day one. We wanted to protect people, particularly those who had to do their jobs in person, like our police officers, our healthcare workers, and others, our teachers. But also recognize that there is an economic impact to every time we do something that tries to slow the spread of the virus. We know there's an economic impact. And what I'm proud of in North Carolina, I think we've found that middle, because our economy is doing great. And I know the governor's phone is ringing off the hook with companies who want to come here, expand here, which is fantastic. But we also see in the numbers, our cases are lower. We've never overwhelmed our hospital system, and our deaths are lower. And, you know, I'll take that as a success, lives saved, and the fact that we will recover from this, and I think recover stronger.
In Tuesday's press conference, he announced relaxations in several different ways, several different areas. Let's go through some of those. He said that museums, aquariums, retail stores, barbershops, beauty salons can now have 100% of capacity. He said that was justified because of the science. Tell us what it was about that was kind of the tipping point that made you decide that.
Yeah, so our scientific team, in coordination with looking at recommendations for the Centers for Disease Control and others, and really understanding, again, what we have learned over this year about how does this virus spread. We know that there are settings and activities that are lower risk. It doesn't mean there's no risk, but lower risk. We know things that are medium risk and things that are higher risk. And generally, the lower risk activities tend to be ones where you aren't sitting down for long periods of time. You can keep your mask on the whole time. You have short interactions with people. Hopefully they're outdoors if possible. So settings that you just mentioned are those lower risk settings where you're moving, you're not sedentary, you have short interactions with folks. You can be physically distanced from those. You keep your mask on all the time, as opposed to higher risk things like a restaurant or a bar. You know that you're taking your mask off when you eat or you drink, right? So that increases your risk of spread in those moments. And so we tried to help folks understand there are some places that are lower risk and they can be open, and I would say up to 100%, because they still need to make sure they're focusing on the 6 feet of social distance. So some of those places may not ever be able to be truly 100% depending on the way they're configured. But up, what we're saying is it's lower risk as far as you can go, still maintaining that 6 feet of social distance.
Which helps explain, I guess, why restaurants and amusement centers and gyms and pools can open at 75%. There's a little more risk there. But let's talk a little bit about the conference centers and sporting events and live performances. That's still at 50%. Is that because you think that's a higher risk?
That's right. So the things like bars and conference centers, big stadiums and arenas, we feel are higher risk, and it's largely driven, frankly, by the sheer number of people, right? We know actually here in North Carolina, if you remember all the way back to last year, some of the earliest cases in North Carolina were seeded from a conference many states away, from a conference up in Boston, Massachusetts. So we know that those are high-risk settings when folks gather together. They often are eating or drinking a cup of coffee at a conference. We know that, but it's also the nature of the activity, different than a restaurant. When you may go to a restaurant, often the folks at the next table are strangers to you. When you go to a meeting or a conference, the whole idea is to interact with the fellow members of that conference. That's why you're kind of being there, not just to sort of sit and not talk to folks. And so there is a different nature of the activity. And again, we just tried to look at what the nature of the setting as well as the activity. And remember, in places like stadiums, you're going to do some cheering. We understand that. We want you to cheer for your team, but when you cheer, that means you're expelling more air from your body, and you're yelling, you're singing, and again, just higher risk there of more viral spread. So we just want everyone to understand that there's more risk. So let's keep the occupancy a little bit lower for now, and make sure we're doing the masks and the social distancing.
It's no surprise that there are a number of people who are saying, yeah, true to form, Governor Cooper didn't go far enough, fast enough, citing other states and saying that Florida, South Carolina, a number of these other states have opened things up completely, and they're doing okay. And how do you respond to those people that say we're not doing it fast enough?
Yeah, well, we've heard that for a year, and I think the numbers speak for themselves, right? We're trying to use an approach that looks at the data and the science, that tries to understand how this virus is spread, and to respond accordingly. Those that are lower risk, great, let's open up, wear masks to still protect each other, open those up. The things that are higher risk, and again, the list is very small of the things that are higher risk, bars, stadiums, conference centers, right? The majority of things are 75 to 100% open. We're just talking about a few places that are half. And again, I think that is, again, for a moment in time. And I'd remind folks is that when you really look at our metrics, we're going in the right direction. But what we've actually seen over the last number of days is what I'd call a leveling or a plateau. And that's good. I'm glad that we are not going up. We are plateauing. But I think we have to keep our eye on that and make sure that we're not going to go in the right direction and work as hard as we can, like I said, to get those vaccines out quickly. largely our vaccine speed is limited by supply. But I'm hoping in the next couple of weeks, we're told by the federal government we should be expecting more vaccine, and that's going to be great news for us in the state.
I want to underscore that because one of the messages that both you and the governor delivered was this isn't over yet, and we're not through this yet, and we can't completely relax everything yet. Talk about that for a second.
Well, I want everyone in North Carolina to have the opportunity to have a vaccine and be able to be protected before I could say we are, really on the other side of this. And we're not there yet. We know that we're still in the middle of eligibility categories for vaccines. We're in group 4 right now. When we get to group 5, we'll be open to everyone. But even then, when we're open to everyone, it's going to take a bit of time to vaccinate all of North Carolina. And so that's the patience I'm asking for, is while we work to get everyone vaccinated, let's keep working together to protect each other, slow the spread of this virus. It breaks my heart to think about anyone getting COVID in this moment when we have 3 safe and effective vaccines that can prevent it. So just let's hang in a few more. I do think it's on the order of weeks to a couple of months. I am very optimistic of that. So there is light at the end of this tunnel, but we're not there quite yet.
You mentioned earlier, and you did in your press conference, 31.7% of all adult North Carolinians, 18 and over, have had at least one dose of vaccine, and 18.8%, almost 19%, have had 2 doses of vaccine. The governor said that the hope is that we can open this up to everyone who wants a vaccine by May 1. You indicated that perhaps maybe with some of the increases in supplies that you're being told about, that maybe that might come sooner.
I think so, Tom. We've been talking with our vaccine providers, and what they've been sharing with us is that the time it's taking to sort of manage some of the eligibility categories and the wait list is actually, they're just weighing that and saying, I actually could vaccinate a lot more folks and particularly meet our equity goals related to vaccinations if we accelerate through the groups a bit more. And so we definitely are hearing that feedback. So I think we are going to be open into group 5 well before May 1st. Now, that doesn't mean everyone is going to be able to get the vaccine, on the day we open to group 5. It's going to take us some time to work through. But like I said, I think by early to mid-April, there's going to be vaccine eligible for every adult in North Carolina, and then everyone just needs to work through getting their spot and getting their shot.
We keep reading these stories and hearing these stories about hesitancy to get the vaccine, reluctance, particularly in some areas of North Carolina, for instance, rural areas of North Carolina, among some races in North Carolina. Talk a little bit about where we are, what you're experiencing so far as vaccine hesitancy or reluctance or outright denial. I mean, we're hearing is percentages of up to 30% of the adults don't want to take this.
Well, I think, look, we've always known that there was folks who rightly had questions about this vaccine. They want to understand it for themselves and what it will mean for them and their bodies and their families. And what I would say is, as they are seeing millions of North Carolinians get vaccinated, and we have, as we've given out, upwards of 3.5 million doses, and they watch their friends, their pastors, their work colleagues, even their athletes that they cheer for on TV, watching them get vaccines, everyone, the governor, myself. I think everyone's saying, I want to protect myself, my family. I see everyone, this is safe. They're learning about it. And so actually, I think we are making a lot of progress on that front. What I actually think we have to make sure we're doing is making accessing the vaccine or getting the vaccine easy for folks, right? Particularly for folks who have, really busy jobs and really busy lives, we've got to make it easier for folks to get the vaccine. And that's what we're really focused on, is to make sure that it's close to someone, that they know how to get it, they can get an easy appointment. And again, that's been hard when the supply is so low, right? When the supply is low, it's hard to get everyone in and make it easy for it to be accessible. But that's the work we're planning right now. So as we get into April and May, we want to make it a lot more easy for folks to just be able to get the vaccine.
I guess the question that a lot of people would want me to ask you is, if the percentage is anywhere close to those 20-30% people who won't get shots for one reason or another, how's that going to hold up our herd immunity, which we were told was at least 70% of all the populace having the vaccinations? Is this going to slow down our reopening? Is this going to mean that it's going to take even longer to get to a point of normal?
Well, what I would say is that, what I've been looking forward to with vaccines, and I've said this in press conferences before, is for me, vaccines equal hugs. And I'm excited that I'm now fully vaccinated. My parents are fully vaccinated, and actually they're going to be visiting for the first time in 15 months. And I'm going to get to hug my mom and dad for the first time in 15 months. And so what I would say is that we need to focus on what these vaccines can bring back to everyone's life. It's the things we've been missing, the people and places we love, and vaccine is our path to get there. So I think if we focus on that, show folks that they're safe and effective, remind folks of the things we want to get back to, I'm really optimistic that we're going to see folks take this vaccine. Again, we got to make it easy for folks to get it with hectic schedules and such. So we're working on streamlining that, but that's where our focus is. And yet there will always be folks who, before we started this, I get a lot of mail about they don't like vaccines, they've never liked any vaccine. I understand that, but that does put our community at risk. And so we are hopeful that as many people will get this vaccine as possible. And I think folks want to. What I continue to hear, as soon as they learn about it, they see others in their community getting it, it's easy for them to access it. I think we're going to do okay, but we're going to have to work hard at it. And we'll need a lot of partners to work on that.
I had a conversation with a person this past week who said she's not going to get it. And I said, really? And she's in a related care position with a congregant care facility. She's not going to get it. I said, really? I don't understand that. One of the terms that you and the governor talk quite a bit about is administering the vaccine fast and fair. What does that mean? Well, look, we know supply is limited. We know it cannot sit on the shelves. It's got to get into the arms of North Carolinians as quickly as possible. And that's one thing I'm incredibly proud of, is you can see our vaccine week goes from about a Wednesday to Wednesday. We get new doses from the federal government on Wednesdays, and generally by Sunday, we're out. We don't have any first doses left on the shelf. So that's fast, which is great, which means that, again, people are getting protected as quickly as possible. But the fair part is really important here. And I think this is where North Carolina is an incredible standout. And we've gotten national attention, and folks from other states are coming to visit us to learn how we're doing our work. But we are, it's great. It's wonderful. We have said and prioritized from the beginning, fast is important, but we can do fast and fair together if we put our shoulder against it. And so we baked in equity and fairness to every aspect of the vaccine, everything from how we allocate it to where we allocate it to our expectations of our vaccine providers to how we engage community groups to work with us. And I want to say the faith community has been incredible here. They have partnered with vaccine providers to host events at churches, to make sure their congregants were able to get
prioritized for appointments. So those partnerships have been incredible. And what I would say to any other state that wants to replicate North Carolina's success in equity is partnerships. I think it brings out the best of North Carolina in making sure that we're getting to every community, rural, urban, Black, white, Latino, everything. That's what we needed to focus on, and the numbers speak for themselves.
You talked a little earlier about the variants. And so far as it's concerned, the UK and the South Africa variants seem to be the two that are more prevalent. How big a deal is that in North Carolina? What percentage of people are you seeing that actually have those variants of the disease?
Yeah, so I mean, it's hard to say because we don't sequence every test that is done. So we only have some estimates. But what I would say is the variants are growing, and that's not surprising because these variants are more contagious, right? So a more contagious virus is going to spread faster than a less contagious virus. And so we are seeing, a pretty quick growth of both the UK variant and the South Africa variant. And there does seem to be some geographic components to the South Africa variant. It seems to be highest in the South Carolina, Florida, North Carolina area. So clearly there was something about our geographic region so far that seems to have the highest. Again, not as high as the UK variant, but those are the two that we are keeping our eye on. The good news is a vaccine is still effective against these variants, so that is good news. But this virus will keep changing, and that is a feature, not a bug. Bad pun, but like that is a feature of what viruses do. So that they change, and that's why our scientists are going to have to follow that change to know: are we going to need a booster vaccine? I don't think anything has gone wrong if we need a booster vaccine. I think that should be expected at some point that we will all need boosters.
I want to talk about schools for a second, but while we were on the subject of supplies and administration of vaccines, the CDC has changed their recommendations now and says, and you have incorporated this also, saying that instead of just allocating vaccine according to a county's population, you're going to change it and allocate it according to the percentage of people in that county that have not had vaccines. Explain to us why that is desirable.
Sure. I think it's an extension of our fast and fair strategy in getting vaccines out, is that we are looking for where are less folks in the community actually vaccinated and then send more vaccine there. I think it's intuitive. Before, when we were just starting this, we used county population, again, trying to make sure we're getting to every community all across North Carolina. But now that we have about a third of folks who have gotten at least one vaccine, we want to make sure that we are being equitable across counties and trying to make sure we're getting into every community. So we're doing that. The important part to know is there are more vaccines coming to North Carolina than just what comes to the state. Some are going directly to, for example, Walgreens. Some are going directly to our military bases through the Department of Defense. So there are other ways in which folks are getting access to vaccines. So it's not a perfect science yet because we don't have visibility into all that data, but we're doing the best we can with the data we have to try to use it to make sure we're fair across North Carolina.
So with these relaxations, I heard you and the governor both say there's no reason why we can't reopen our schools, particularly after the CDC said instead of having 6 feet of separation, it's okay for kids to have 3 feet of separation. Talk about that just a second.
Well, just a reminder, we have said schools can be open this entire pandemic, right? Because other than right at the beginning when we're still trying to understand this virus, since July, we have said elementary schools can be open full time this entire school year. The question had really been about middle and high school because we see that the virus spreads more easily in middle and high school settings. It spreads more like adults. So the question really was, are we able to more fully open middle and high school? And I think there was new data that came out in just the last few weeks that showed even in middle and high school, if you're wearing a mask, mask, and if you're doing the other safety protocols, you can be less than that 6 feet of distance. It can be 3 feet of distance. And so, we've always said, let's look at the science and the data and go with that. And so when we have new evidence, we incorporate that into our thinking. And again, we've always said that our elementary school students can be in school 5 days a week and can be at that 3 feet of distance. It was really about middle and high school. Great to have this new evidence. And the other part of this is we know that teachers have been vaccinated.
Yeah.
And our adults have been vaccinated. So that's good news.
Secretary Cohen, it was March 4th of last year. I went back and checked my records. March 4th of last year when we did our first interview with you. And throughout the course of that year, you've been the face and the voice and the person who has helped us understand and explain. You've calmed our fears in many instances and helped us understand what was going on and why. And I need to announce to our viewers that this will be our last regularly scheduled interview with you that we've done on an every other week basis for a number of months. And I will say that in the event that something comes up and we need to come back and do another one, you're willing, we're willing, whenever possible. But I want to thank you so much for helping us get through this situation in such a great way. You've made a lot of friends, and we want to thank you so very much for this. Any closing word from you? We got about 30 seconds.
Well, first, Tom, I want to thank you being a partner in helping folks understand a really complex topic of this pandemic and things changing all the time. So thank you for the time. And just thank you to the North Carolinians have worked so hard to protect each other. I know this has been such a hard year, and we are going to run through the tape, get everyone vaccinated, and get back to the people and places we love. But don't forget the 3 W's in the meantime.
Thank you again.
I had to get one more 3W in there.
Here's a tease for what you're going to see next week on COVID Uncovered.
The next day when I woke up, it felt like I was having COVID all over again.
Experts say it's normal to experience side effects from the COVID-19 vaccine. But why are some people more at risk than others? That and more next week on COVID Uncovered.